My name is Marina Zisi. I'm from Frisco, Texas, originally from Kansas City, Missouri.
And I'm Connor Zisi, also from Frisco, Texas, originally from Kansas City.
This is pregnancy number 6 for us. We have a 2.5-year-old little boy. We've had our share of losses along the way. In doing research and figuring out what kind of care we needed based on our past history, it led us to high-risk pregnancy doctors, and it was a great decision for us.
And we knew immediately once we came here that this was the right fit for us.
When we came to Dr. Lazovi's office for the first time, we were about 16 weeks pregnant. We were given false hope from our current practice, and what set Dr. Lazovi apart was just her care and her willingness to look at alternative options. Unfortunately for us, it was too late, but we do know now, looking back, had we been with her from the beginning of that pregnancy, the outcome probably would have been completely different. Our ultrasound experience was completely different in the past versus now at Dr. Lazovi's office. I will say, having the ultrasound and the anatomy scan at 18 weeks versus 20 weeks with our current pregnancy has given us a great deal of hope. With our current pregnancy, we're dealing with amniotic band syndrome, and that was caught at 18 weeks. Had it been caught at 20 weeks, which is when typical doctors' offices do their anatomy scans, we would have risked losing his hand and possibly further damage.
So for us, the AIUM certification was incredibly important because of our son's condition with the amniotic band syndrome. If they were not able to identify this, which is an incredibly rare occurrence, they simply would not have never been able to fix it.
Right.
Our son would have most likely been born without a hand.
Right. And I think the AIUM accreditation that Dr. Lazovi holds is extremely important in both high-risk pregnancies and then those that aren't, because our first pregnancy was not considered high risk, but every subsequent pregnancy after that was. So you don't have to be high risk to walk through her doors and get care from her, but she is going to give you the best care and identify issues that maybe some other doctors likely would not. My experience was walking through the door, I knew that this was the right decision. The way that the staff treats you, the way Dr. Lazovi takes the time to sit down and walk through everything, even if it's a normal scan. We never got that at our previous office. We were outsourced to a different office to have our sonograms, and so we were trusting in the process that they were communicating with our OBGYN and that he was getting all of the results, and that ultimately wasn't the case. You meet with Dr. Lazovi at every doctor's appointment, and she makes sure that you're clear on what your case is, whether it's a normal pregnancy or whether it's high risk. But we could not be happier with our decision, and we hope that you guys will consider her office as well.